Welcome to Perimenopause Hell. This video is about phases of perimenopause, and we'll also begin by trying to explain what menopause is. So, this should be helpful to new ladies who've just arrived at the group. Perimenopause is the 10 or so years before you go into full menopause. So, during perimenopause, your hormones are slowing down. They slowly get less and less, so your estrogen levels decline. Your body doesn't produce progesterone all of the time, but without going into that, progesterone also becomes lower. It's not as important a hormone as sometimes we are led to believe by people that sell progesterone creams and so on. Your body continues to make a small amount of testosterone, which is thought to be responsible for female sex drive, but it's the lower estrogen that causes us most of the problems. The average age for full menopause in America is 51, although we have plenty of women in the group who are 58, 59 years old and still having regular periods. So please don't think that everything is just going to be over at 51. Things may go on for very much longer. So if we look at a picture of the female reproductive system, you'll see our good old friends, the ovaries here. Once a month, your ovaries pop out an egg. I love doing that noise. So an egg pops out and you start making progesterone up until about day 26, when the little blister that made all the progesterone heals. And after the progesterone stops being produced, that's when you have a period. So your cycles have gone on like this for many, many, many years. And your ovaries make all the hormones that are necessary to keep this going. So they produce estrogen, which actually helps to mature all the eggs that pop out of the ovary. And they make your body what it is. So they make sure that your breasts are nice and full and you're healthy and fertile and you would carry a baby well to full term. That's the whole idea of these hormones, is to make sure that you're able to bear children. And when you get to the end of your reproductive life, your body kind of shuts down. It stops making estrogen. It stops putting the eggs out every month. And really, those ovaries just close down. That's it. No more babies, no more estrogen, and everything changes. So, really, menopause and the symptoms that go with it are all about estrogen withdrawal. So, in a tiny way, it's a bit like being in drug withdrawal, only you are in withdrawal from estrogen. Now, when you're in early peri, your estrogen levels start to dip a little bit, and that happens at various times of the month. But generally speaking, you still have a normal sort of amount of hormones. It's just that your body starts putting them into your bloodstream at weird times and with weird amounts. So sometimes you've got too much and sometimes you haven't got enough. And this causes all sorts of mad, chaotic symptoms. Basically, your hormones start to fluctuate in all sorts of unpredictable ways. Although there are patterns. So I'm going to break this video into 3 different sections: early peri, mid peri, and late peri, and you can see for yourself which you think you are. But you should, of course, bear in mind these caveats. You may not be typical. So you may find none of this applies to you. You may be one of those unusual women whose periods just stop. You don't have any symptoms. Your periods just stop and that's it. It's all over. Most women are not like that. Okay? Most women are not. Most women have this kind of pattern that I am going on to discuss. But what you might find is that you have many years of early peri symptoms, and then you experience some late peri symptoms, maybe for 2 or 3 months, and then you pop back into early peri again. Then you move into mid peri, and then back into early peri, and so on. You may find you flip flop between these different states. And so when it comes to the sort of symptoms, you recognize it's a bit like playing whack a mole. You manage to perhaps nail down your breast pain, only to find that things change and you don't have any more breast pain, and you have other symptoms. You start getting hot flushes and whatnot. Anyway, we're not going to talk about the treatments to all these different symptoms. They're in the other videos. Let's just talk about the symptoms that you get. So, quite often, the first symptoms you get, you may not even realize they're related to perimenopause. Your doctor may not realize they're related to perimenopause, which is incredibly common. But to summarize, you may feel like your premenstrual syndrome that you used to suffer from a few days before your period started seems to take up all of the month. And the relief that you had when your period stopped is just a couple of days, and then the whole thing starts again. So I'm talking about sore breasts, tender breasts, mood swings, spots. This can last nearly all month. You may find that your menstrual cycle is much shorter. So, where women are used to the whole thing taking 28 days from start to finish, your periods may now, the whole thing may be 21 days, so that basically everything is going in 3-week cycles. You may even have 2 periods in 1 month, and the commonest pattern for this is that you get to the 14-day mark when you're due to ovulate, and then your period starts again. This is probably because you didn't ovulate once, and so instead of going through your luteal phase, you just have another period instead. All these kind of random things go on, and it's all totally normal. Nothing's wrong with you. It's just that your system is tired of going through this whole routine every month, and it starts just being quite chaotic. You may feel tired all the time. Some women just can't get enough sleep. They feel exhausted, and there really is very little that you can do to help it apart from indulge yourself and sleep as much as you like, because later on you may not be able to get much sleep at all. Spotting is a very, very common symptom in these days. You see, what happens is it's not the quantity of progesterone that is as much of a problem as the quality of it, which means that the lining of your womb may become a little bit too thick. You may develop fibroids and polyps and other problems like that, which make the lining of your womb a bit unstable. So you might bleed a little bit after sex. You might bleed a few spots before you have your period, and in fact, after your period, it may take a long time before the bleeding stops altogether. So you have a few days where there's just this sort of brown, weird discharge. Every time you go to the toilet, it's just there on the loo roll, and perhaps a few bits in your underwear. It's hardly worth putting a pad on for it. It can be really, really annoying. There are ways to stop that, and I will just suggest Agnes Castus Vitex, because it's one of those supplements that I really wouldn't be without. For me, it completely stopped all the spotting. You might also have very heavy periods at this point, with all the joyous things that I've mentioned already, like fibroids and polyps, and a nice fat womb lining. Endometrial hyperplasia is the medical name for it. And nausea and dizziness and things like that also become quite common. Moving on to mid-peri, you may find you retain some of the symptoms from the earlier peri that we just discussed, but you begin to get symptoms from the late peri as well. So you might start to get symptoms such as hot flushes and night sweats, but they won't be every day. And you will be able to notice a pattern to it. If you look at our video, which is called Understanding Your Cycle, we have a matching file on the topic too. You'll notice there are particular times in your cycle when these symptoms appear. This is usually when estrogen is low, because even when you were a younger woman, your hormone levels did not stay the same all month. The level of your hormones is related to specific events that happen every cycle, particularly a couple of days before your period starts. Your estrogen and progesterone levels absolutely tank. And this is a steeper drop once you get into peri years. And this drop means that your estrogen in particular is low for the next few days, say for the next 7 or so days. And it doesn't start to rise again until around day 5 of the new cycle. And this is when you're most likely to notice hot flushes and night sweats and stuff. So you can find things that will alleviate those symptoms, but because you are not yet in late perimenopause, you can't take those remedies all of the time. You're not ready to take them on a daily basis. And in fact, it's not going to help if you do, because your estrogen levels are not low all of the time. They're low for a few days. And in fact, the supplements and hormonal medicines that increase your estrogen level, they're only useful for those few days. And if you take them all of the time, at this point, you're in fact going to cause other symptoms, like you're going to get heavier periods and your cycle is going to get shorter because there is simply too much estrogen going on now. So you can only really take things for those few days whilst you're actually having the symptoms. At this point, you may notice that your cycle lengthens again, and you may even start to skip a period now and again. Now we move into late peri, and the classic menopausal symptoms begin to dominate, and these are a result of low estrogen levels primarily. So you can develop hot flushes and night sweats, or hot flashes as they call them in the US, insomnia, which in fact is hormonal insomnia, and you may find that things like Benadryl or Valerian that you had taken previously when you had a couple of nights bad sleep just don't work anymore, and they might not work at all until you start to address the low estrogen. You may skip periods 2 or 3 at a time, but then you may have very, very heavy periods when eventually a period does come along. You may experience urinary problems and atrophy caused by vaginal dryness. We've got videos and files on all of these different problems, by the way. The other classic thing to notice at this time is cognitive problems. So women think they're developing dementia or ALS, and in fact, the memory loss and confusion is to do with low hormone levels. So it's similar in a way to, if you've had a pregnancy, you may remember when you had the baby. Up until you have the baby and deliver the baby, hormone levels get progressively higher. In fact, they're extremely high while you're pregnant to support the growing baby. When you deliver the baby, they drop steeply. This can cause postnatal depression, and it can also cause what we used to call baby brain. So, you're absent-minded and forgetful, maybe a bit emotional and all the rest of it. And the same thing happens at menopause, only it's more pronounced and it happens for a longer time. So these cognitive problems are supposed to be worst the year that your periods stop, which is the actual year of menopause. And they are supposed to improve again after that year. So there is some good news there. These late peri symptoms are the worst symptoms of perimenopause. Let's not beat around the bush there. They are the worst. But the good news is they are the easiest to treat, because at this point, when you get very, very near to menopause, your hormone levels are not bouncing around quite so much. They're more stable, the estrogen is just low. And so the treatments that are available to you, such as hormone replacement therapy, phytoestrogen supplements, various other medicines such as clonidine, which is a blood pressure medicine that can be used for hot flushes, and antidepressants, which you should never dismiss as being unsuitable. Don't let anybody make you feel bad or ashamed if you take those, because they are also very useful for hot flushes. There's a whole heap of things that you can take. Nobody gets any medals for going through this and toughing it out without some help, okay? So these are the three major phases of perimenopause. Not everybody is the same. You may find you are completely different, or like I said earlier, you may flip-flop between different phases. But this is the standard pattern. Unfortunately, nobody can tell you how long the late phase is going to last. It may be over within a year. It may go on where you have 2 or 3 periods for 5, 6 years. Nobody can tell you, I'm afraid. And of course, it is a miserable business. We can't really pretend that it isn't. But on the plus side, there are so many different things that you can do for your symptoms now. It's not a wilderness out there anymore. We are educated and empowered, aren't we, girls? So it's not all bad news. Okay, well, that's the end of this video, and I'm going to say all that boring YouTube stuff as usual. If you found it interesting and informative, like and subscribe, give me a thumbs up, and hit that notification bell. Thank you very much for watching. Bye bye.